Lice Killing Shampoo is used to treat lice, which are tiny insects that can infest and irritate the scalp, head lice, the pubic area, crabs, or the body. This shampoo works by paralyzing and killing lice. It is important to use the shampoo according to the instructions provided on the bottle. It is usually applied to the affected areas and left on for a certain amount of time before being rinsed off. It is recommended to use a fine-toothed comb to remove any dead lice and nits from the hair after using the shampoo. This medication is typically used as a one-time treatment, but in some cases, a second treatment may be necessary. It is best to use the shampoo at a time when you can leave it on for the recommended amount of time without interruption. Be sure to carefully read and follow the instructions provided by the manufacturer for your lice-killing shampoo. Only use the product on the outside of the body and avoid getting it in the eyes, nose, mouth, or vagina. If irritation occurs, seek medical attention. Do not use the product on eyelashes or eyebrows unless directed by a doctor. When applying to an infant, cover their hands and feet to prevent them from putting the product in their mouth. Make sure to apply the shampoo in a well-ventilated area, such as near an open window. Thoroughly cover the affected area with the shampoo, leave on for about 10 minutes, then rinse and dry with a clean towel. Use a fine-toothed comb to remove any lice eggs from the hair. Repeat the application 7 to 10 days later to kill any newly hatched lice. If your condition does not improve after the 2 treatments, consult your doctor. If you experience skin irritation that lasts or worsens, it's important to notify your doctor or pharmacist right away. Your doctor has determined that the benefits of using this lice-killing shampoo outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While rare, a serious allergic reaction to this shampoo may occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. In the US and Canada, you can report side effects to your doctor or the respective health authorities. Before using lice-killing shampoo, make sure to check with your doctor or pharmacist if you have any allergies to pyrethrins, piperonyl butoxide, chrysanthemum, or ragweed. This product may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, especially if you have had skin infections in the past. If you experience constant or hard scratching of the skin or scalp, it can lead to a bacterial skin infection. If you notice worsening redness or pus, it's important to consult your doctor immediately. If you are pregnant, lice-killing shampoo should only be used if it is clearly needed. It's crucial to talk to your doctor about the potential risks and benefits. It is not known if this medication passes into breast milk, so it's important to consult your doctor before using it while breastfeeding. It's important to be aware of potential drug interactions when using lice-killing shampoo. These interactions could affect how your other medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of lice-killing shampoo. If the lice-killing shampoo is accidentally inhaled or swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, diarrhea, and unusual drowsiness. Always be mindful of the proper usage and keep it out of reach of children. Remember not to share this lice-killing shampoo with anyone else unless your doctor tells you to. To prevent spreading lice or getting them again, make sure to wash all headwear, scarves, coats, and bed linens in hot water and dry them on high heat for at least 20 minutes. You can also dry clean these items, seal them in a plastic bag for 2 weeks, or spray them with a disinfectant that kills lice. Additionally, soak brushes and combs in hot water for 10 minutes, soak them in alcohol for 1 hour, or simply throw them away. Don't forget to thoroughly vacuum furniture and floors. If you're in close contact with someone who has lice, like a family member, make sure to check yourself for lice and nits. It's also a good idea to consider treatment even if you don't find live lice on yourself, to prevent infestation. If you forget to use the shampoo, be sure to talk to your doctor or pharmacist. Remember to store the lice-killing shampoo at room temperature and keep it away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.